Hi, everybody. Welcome to Needles and Nonsense. We're here
Hi.
for another episode, and we have a really special guest today, our medical director.
Yay.
Yes, this is Akash, and we're so happy to have you here.
I'm very excited to be here and excited to work with you and the whole team. So this is just a really natural extension of our relationship.
Yeah, we can kind of dive in. I mean, I feel like we're going to learn a lot from each other this episode because, I don't know, when's have we ever had a chance like for the three of us to sit down?
No,
Okay.
it's actually you're our first, like, kind of outside Elevate, but not Elevate, but our first, like, guest star and the best star.
Perfect. Well,
We saved the
very
best for
excited.
first.
And
Yeah.
thanks for having me.
Of course. Awesome. So we're going to, kind of dive in. We'll talk about first, like, how you even became our medical director, like, how it all started. I mean, right now we've probably known each other for well over 2 years. How long
Yeah.
have you been in Tampa area?
About 3 years now.
Okay.
Yeah.
Yeah. So I was thinking that time was going by. So,
Yes.
yeah, I would love to first hear a little bit of how you got into aesthetics. I would like to hear a little background on that.
Sure. When I was in medical school, I really hated the hospital. I almost said I'm not going to do clinical medicine after my third year of medical school. It was sick patients. The nurses were upset. The people providing the care were upset. Everyone, it was just like a bad workplace environment.
Yeah,
So
it beats you down sometimes.
Yeah.
I said,
It's tough.
especially being at the bottom of the totem pole as a third-year med student, I was like, this is not it. And
So you
I saw
knew
my
it.
colleagues kind of in other places having much better workplace environments and compensation and things like that. So I said, why would I go through this when everyone's upset around you? Just you come home not feeling great. So I thought just clinical medicine wasn't for me. I loved the science. I loved the biology. I loved all that aspect of it. But the actual practice of medicine in the hospital seemed really like a terrible workplace environment. So I thought I was going to go just do management consulting afterwards. So I kind of applied to some of the big management consulting companies, and I thought I was going to do that.
So you always had like a knack for the business side then.
Or I was trying to get into it. I think I enjoyed the innovation and the research, and I just didn't see it happening it happens at a snail's pace in these big academic hospitals. But at Harvard, I was in a program where I had to do a research thesis. So I took a year off to do my research thesis, and I said, let me just do whatever's cool, whatever seems fun. And the first face transplants were going on at that time. So I said, I'm going to do my research thesis with the face and hand transplant team at Brigham and Women's Hospital. And so I spent a year working with them, and those were run by the plastic surgeons. And plastic surgery actually really was the start of transplantation. The first kidney transplant was done by a plastic surgeon, and the only plastic surgeon to win a Nobel Prize. And so that was the first time where I saw people came in and left happier than when they came in. Everywhere else in medicine, you come into the hospital and you leave lesser or sadder or with something just
A new problem.
more
or-
devastating to
yeah.
your life potentially. And I saw the opposite of that. I saw people regain confidence, regain function, regain their ability to go out into the world. Some of these people who had these devastating injuries to their faces. So I said, maybe there's something to this. So I said, well, let me give it a try. I'll see. Maybe I'll apply into plastic surgery and see if I get into programs I want. And maybe I'll just defer my consulting commitments for a year and get my intern year done. And then kind of one thing led to another. Then intern year finished, and I said, well, I got done with the worst of it. Let me just do another year. And then here I am still going.
Right. Yeah.
But I never was in a place where I wanted to work in the hospital. And I think one key piece of advice I got was find a patient population that you like to work with and just focus on that. Everywhere else changes in medicine. We see it now with all the AI stuff and everything. All the technologies, the procedures, the things that we do will always change as technology progresses. But the patient population that you like working with won't. So I enjoyed working with like very driven and involved in their care, healthy young women. So the two options were plastic surgery, aesthetic plastic surgery in particular, and like obstetrics really. And so I actually applied into both.
Oh, you did?
And I said, we'll see where I land. So match day came, and I wasn't sure if I was going to be in
I thought you were going to say like
or
hell
if I
no
was
to
gonna
the
do a plastic
OBGYN
surgery.
side. And it was
But,
like an
you
easy
know, there's another-
OB
decision.
seems like the most exciting day, but also it could be the worst day, and I
could.
don't know if I can bear that.
And you're
Like,
still in a
oh my
hospital at the
gosh.
end of the day. I mean, I guess if
You're in a hospital, but it's a moment where people come in and they leave generally
Happy still,
happier
yeah.
when
Yeah.
they came in. They have this new baby, they're excited. I like having that excitement and positivity at the end of your encounter. Otherwise, you know, you see burnout happening across medicine, and it's because people just feel like their efforts don't result
All
in
my
like
ER
positive
friends are
energy,
already burned
right?
out.
ER is a
Yeah,
great
they're so
example of
burned
that,
out.
right? So, you know, I ended up matching into plastic surgery, and then I had kind of my eyes on for like outpatient aesthetic surgery because of that same premise that I really enjoyed working with that patient population of a really engaged, healthy woman who wants to regain confidence and come out in a just happier place than when they started. And that's what kind of why we do what we do, is to
I would
bring
say
confidence to
mine
patients.
echoes that way too.
For
Like
sure,
I worked
yeah.
in the hospital and then I just get tired and drained, and here it's like I love walking into a happy, upbeat, and most of the time it's very positive, and people are so happy, and
Yeah.
I love that
It's-
part.
Yeah, it's
Yeah.
a great way to go into this field for sure. And I think it takes away sometimes some of the like superficial aspect of the field and makes it a deep like interpersonal relationship with those patients. So tell me a little bit how your introduction to Elevate started and how you ended up being our medical director, because this just happened, I would say, like the end of last year?
Yeah, a little less than a year ago.
Uh-huh.
You know, when I came to Tampa, the Tampa Bay area from Jacksonville, and I was working with a group that was kind of interested in opening up a bunch of med spas in the area. And well, I said, I don't really know anything about the injectors in the area and what it looks like there. And I was trying to establish my practice too. And I've always worked with injectors and estheticians really collaboratively. And I think that's like where the best referrals happen back and forth. It's where the best discussions happen, you know, just us talking about, you know, different cases based on anatomy and the expertise that each kind of domain has allows for a really nice, well-rounded care. And I think when I was in Jacksonville, I worked with some injectors and estheticians really well in actually having those patients understand that continuum of care that we offer kind of everything for you. So we're not selling you on anything. We're just providing you with, you know, the best options for you that are between our whole group.
Yeah, the
So
broad spectrum.
I wanted to kind of recreate that. And so when I came to the Tampa Bay area, I tried to meet as many of the injectors and estheticians as I could, and met some of the Elevate
You have to give a
injectors
shout out
as
to
well.
Alyssa.
Shout out to Alyssa.
This is where my nonsense part wants to come in. And like I was always with Alyssa, and then when she told me she went to dinner with you one night, I was like, I don't know why, but I feel like I have to be connected into this somehow. Like
Yeah,
this
because you were
person's meant
great
to
at
be.
bringing together injectors, like she said, doing roundtables, discussions.
Yeah, and then
Now-
you actually made me, like sometimes doctors can make you feel a little intimidating because you feel like you have to prove yourself to them a little bit.
Yeah,
like
that's
you're,
where like a mid-level
Yeah.
provider. That just was like an organic feeling.
In
that
the
really
hospital,
felt.
I gained a lot of respect of doctors, so that gave me a lot of like confidence that okay, I deserve respect. So sometimes meeting a new doctor could be a little intimidating, but you made me feel so comfortable. Like I could just ask questions, and you were all about just answering and talking.
Yeah.
And
So
at that point,
non-judgmental.
then I
That's
feel like
so
again,
great.
I'm like, okay, I feel like this guy's meant to be in my life somehow. And then like we had a little hiccup at work, and like I don't know why, but instinctually I called you.
Yeah.
I was like, I need to ask this man
I don't
a question.
even think she called our
No,
medical
I didn't
director
call
at the
our
time.
medical director. I just
And
called
not that
you.
he
I was
wasn't
like,
fabulous, but she just
you
had
made
a
me
more
feel
of a
comfortable.
personal connection to you. Yeah.
and I respected you. Yeah.
You know, I think just having a community that supports each other is really important because we're all going to run into issues. We're all going to run into patients that give us trouble sometimes. And being able to rely on other clinicians who've been there, who've seen it or had this issue or tried something, and would this work, or do you have something that can help my patient? Like that's great to have just in your backpack.
And whether or not they are part of your practice or not, like,
Right.
right, we're all in this to help the patient.
Let's
That's
just
the
say
end
no
goal.
doctor, no practitioner is perfect. There's always going to be a problem. No matter how perfect anything
Right.
goes, it is human nature, and it's
it
just
happens.
nice to have
It's
people
just
to
a
rely
numbers
on.
game, yeah.
And I think all of us are
So-
also like small business mindset, and there's headaches and issues that come with that too. So having just people that can understand where you're coming from, what issues you're dealing with. Are these vendors being ridiculous or not? What's the deal with this? I think it's just really nice to have that community, and it's one that I had developed organically in my practice in Jacksonville, and I really wanted to develop here. And I think I made a lot of friends in that way, but I think just understanding the components of that everyone has their place in terms of expertise, and being able to rely on those expertise in different ways is really helpful.
Yeah. And so pretty much the, timing just aligned perfectly, where you had stepped down from your medical director position at another practice. And then Alyssa knew I was looking for one because our medical director had stepped down at the time, and then the stars aligned. She was like, well, I have somebody for you. And so that's kind of like the rest is history.
And we've always had a great relationship with, with the Elevate team, and you guys consistently have good, safe results, and safety is very important. And I think that's one thing that in our industry that kind of gets overlooked, is the safety components of everything.
For sure.
I think people jump into a lot of things because it's shiny and new, and people don't think a lot about the basic biology and the mechanisms. And I think that's something that drove me nuts, and really landed me doing a lot of research in the area and giving talks about it, and starting fights on stage at different conferences about these things.
Okay,
So
I
that's
have
exciting.
an icebreaker because you say safety.
Yes.
What is the craziest patient request you've ever had?
Maybe not crazy, but I think figuring out the communication aspects between what our patients want is a little bit of a lost art, both on the surgical and the non-surgical side. I think one of the craziest encounters, and it may not seem that crazy, but I had a patient who asked for a natural breast augmentation. And I said, perfect, I'll deliver that.
Yeah.
I did the surgery, delivered the natural breast augmentation for them, and they come back to me and they say, well, my friends don't know that I had anything done when I'm in clothes. And I said,
Gotta love that.
well, what's your definition of natural? And they come and bring pictures of what they think natural is, and it's totally off from what I think natural is. And so, maybe that's not crazy, but it's like we missed each other. We completely missed each other.
Learning experience and communication.
That really taught me a lot about, that is the most important part of what we do, is understanding what the patient's goals are. And I think it goes back to one of our original tenets of medicine, when we learn how to do a history. What's at the top? What's at the top of your note?
Past medical history.
Chief complaint, right?
The chief complaint, past
Like,
medical
what
history.
are they
it's
here
been
for?
times
What is
since
their
I've done
thing?
my
Don't
note,
quiz
but
me
chief
right now.
complaint,
Right?
you're talking about that
understanding
bullet point right there.
what the that's why they're here, and this is what they
Right,
want. And understanding that chief complaint is the thing that gets missed, I think, because it's the smallest part of that entire history. And so, that had totally transformed how I thought about talking to my patients and communicating about what they want. Now we have 15 different things that we do to make sure that we understand exactly what they want, including, we're using virtual reality. We're doing wish pictures beforehand, pictures of patients you don't want to look like.
Oh, that's so fun. We'll get into that because I
things.
feel like you're really big on that, AI consultation, and that's definitely the future of medicine, and we'll kind of close with that. So
But I
remind
think
me.
that helps
but
us
that's
be
so
more
fun.
human with our patients and understand what they want, because in the end, it doesn't matter what I want. That's
I'm
not
even
old school
falling
plastic
into
surgery.
AI to redecorate my living room
Yeah.
right now. I try to say I'm not going to use
all
it, but
gonna be-
AI is so great.
Millennials
It
love
just
AI,
sketches
so.
what's in my head, and it's great.
Okay, so, all right, so awesome. I'm so glad that we've dove into how, you came to be with Elevate, and I do feel like we aligned so well with like you said, our values and our philosophies and stuff. So we're super happy to have you on board, and we hope it's a bright future ahead. But we're going to dive into a little bit about a medical director. What do they do, right? Exactly what does that term mean? I think a lot of people don't know. They hear this term just being thrown around all the time, but nobody really knows what it is. So what are some of your responsibilities as a medical director?
I think overall, to summarize, your medical director is your safety valve, right? So there are things that we're doing, and they all have risk. They all have a potential for serious complications and non-serious complications. And both are very important to be able to handle. And if you can't handle it, you need to have somebody that can kind of back you up and handle it. And so I think that's really the main role of the medical director, is somebody who can be there to take care of issues that may come up that might be out of the wheelhouse or might need some escalation of care. I think about it in terms of like lasers and burns. Can someone take care of a burn, right? As an escalation of something that could happen. With injectables, there's a ton of things that can happen. Probably the one that people think most about initially is vascular occlusions. And do you have someone that knows how to take care of skin that has ischemia or has some threatened tissue in the background? That way, that allows you not only just to be within the regulations of the specific state that you're in, which are different state to state, what a medical director is and can do and should be doing, but moreover, it tells your patient that I've thought about what the complications could be and I have a plan for it if that does happen.
Yeah.
That's how I describe every surgery to a patient. Here's the most likely complication that you can get, and here's what we're going to do if that happens. Here's the least likely thing but most dangerous thing that can happen and how we're going to mitigate those problems. And I think the medical director plays in a role in helping give the full spectrum of care for that patient if any of those things were to happen, because we may not be able to say, if you get a burn, well, I might not be able to take care of that. I might have to escalate that to my medical director who may need to do something or monitor it or take care of that tissue.
But I'm going to even like kind of hone in on something that might be a little taboo, but that's why it's so important to have a medical director who is also board certified and trained in plastic surgery, because you can handle these complications, right? And like just because you maybe are a pain management doctor or you're, primary care physician or some of these other different sectors of medicine, that they're not seeing these things all the time, right? Like you dissect a face,
I'm going to throw my husband under the bus for this one. He's not familiar. We had a VO, and he was like, just go TPA it.
Say what he is, though. So
he is a critical care provider.
Yeah.
So he's a
ICU he deals, like, I met him in a code. He deals
uses
with
ultrasound all the time for placing A-lines
and
and stuff, right?
go TPA it. I'm like, it's not a clot, it's filler. His thought process is there, but like,
I would say somebody who like an interventional cardiologist or a interventional radiologist or someone doing critical care is somewhat more equipped to take care of some of these things like a vascular occlusion than someone who...
I just want them to stock Hylenex in the hospitals. It would make me feel so good.
But would they be able to know how to use it, though, right? It's like just because they have
understand what
Hylenex.
The pathophysiology is, and they have the ability to take care of it, right?
They have the tools, the imaging.
Whether TPA is the thing or not, like
you said, they have
we can argue about that a little bit. I think that's not like a crazy idea. Actually.
Okay, you think you would actually break it down a little bit?
But I think overall, it's the fact that there's somebody thinking about it with you who has a plan that can help you and guide you based on, their expertise in taking care of these things. So, Danny Soares and crew at the Village Institute, they actually did a study they published in PRS about Florida med spas, and only 22% of med spas in Florida had a medical director that was a core physician, that was a dermatologist, board-certified plastic surgeon, or a facial plastic surgeon. 22%. Wow. Right? So that means
way below average.
88%.
Check your safeties.
Right? Didn't have somebody who has the proper training to take care of that.
Yeah.
So if you came to them with the problem, they likely would have to use ChatGPT.
Not saying that no, I know, right? We're not trying to knock anybody, because there's brilliant surgeons and physicians in all sorts of the sectors of medicine. But it's nice that we know that we got the right person behind our back, and our safety net is
And I think it helps also that somebody's in the same, in it with you guys in terms of just the rapidly changing landscape of new products, new devices, new things that are hard to learn about and assess their safety and efficacy, right? So I think that's something that helps all of us learn, what's this new thing? What do we think about it? Let's look at the studies and make sure we're doing the safe things for our patients.
I'm going to have Erin transition into another topic, because she is at our office at least 4 days a week, sometimes 5, but she's there all the time, more than I am. And so we're going to talk. We're going to talk a little bit about just kind of behind the scenes of a med spa versus a plastic surgeon's office, and she can speak on that since, like I said, she's there all the time.
Okay, so what do you think the major difference is between the two, like what you get from them?
I think there's actually not that much difference, right? You have a patient that you see for a consultation. They get information about their procedures, they sign their consent forms, and you do a procedure on them, and then you see them afterwards, right? I think on the surgery side, there's the procedure is sometimes not done in the plastic surgery office itself, sometimes done at the surgery center, sometimes done in a hospital. But overall, I think the process is very similar. And I think that's why, we think about these procedural things, and I kind of treat them all in a surgical mindset, right? You want sterile technique, you want all these things that are important because it is a procedure. You're, invading someone's body with a needle, a knife, whatever it is. So I think we all take that very seriously in a really high level med spa like you guys have, where you have those kind of protocols in place and the checkpoints and safety valves in place, similar to how surgery would be done in the operating room with a formal timeout and scrubbing things and recording things.
So do you have your surgical operating room on site, or do you perform surgery outside the office?
We actually perform it at a Quad A facility off-site.
Okay.
Just because it's a lot in of itself to run that from just a regulation standpoint, and that's just another headache to add to the list. But I think it's very similar how plastic surgery and med spa offices do work, because even from the business side, if you think about it, like you're trying to bring in a patient, we're trying to tell them this is the price of our procedure.
Trying to sell them something in a way.
You have a lot of different options. Here's why you might want to choose me and align with me, and then they choose you and do the procedure, and you try to retain them as well. So it's no different than plastic surgery, except generally, hopefully, most of my procedures are like a one-time thing, so there's not this recurring
I
model
beg
to
to
it.
differ in the med spa version. I hope you love it and keep coming back.
Exactly.
For
Yeah.
So on
But
the
you
plastic
never know,
surgery
though,
side,
because a lot of
Yeah.
times people are only able to
have
do
a top of a list and then
their
they start.
exactly their
We do
breast
see
augmentation,
that.
and then they want their mommy
Yeah.
makeover and all that
we
stuff.
do see
a little
things,
bit of repeat.
and then we see kind of the husbands getting stuff done, and so it starts to
Oh yeah, there you go.
start to
Husbands,
I love it when I
them
get
and
husbands.
their loved ones or friends. So we do see it. Ours is more recurring in that way, that it is within the group. But I think
But overall, they're
experience
similar.
is important, right? The patient experience, no matter what we
Yeah.
do, and that's why you guys provide this like very high level experience for your patients. That's almost a separate thing from the
This
procedure
isn't even
itself,
on
right?
topic, but you said something about this is clinical, and I think nowadays there's so many med spas, and it's about the glitz and the glam. And I feel like I've said this on another podcast, but it is clinical, and it's about what is safe, what is good for that patient. It's not about there's a fountain here and this and a spa and like.
But there's a good
like,
balance,
There's a
though,
great
because I
part to
think-
that, but then there's a clinical side too, and just being professional.
But I think from a
fun.
layman's sense of point of view is that they probably think a plastic surgeon's office is very similar to like a primary, like a doctor's office, right? Like
Right.
they're just thinking, I'm going to see a doctor that's going to look like a doctor's office. But what you're saying is it's like a lot more similar to a med spa, and it is a lot about the client experience, and it is more opening and warm and inviting and welcoming versus just like a doctor's office where you're like a number and you're kind of being funneled through. So
Right.
I do think there's a lot more similarities.
Do you
This is-
think a med spa or a plastic surgeon's office does something better that the other one can't do?
I don't think so. I've seen med spas and plastic surgeons' office do it bad, do it good, have a right balance of providing high level clinical care, also with a great experience, and different combinations of those. I think it's a really hard thing to be able to do both. I think in the end, like your patient outcomes and their experience kind of plays into that too. I think you're less likely to have an unhappy patient. Even let's say you did something and it didn't get the result that you wanted. I think if the patient had a great experience throughout that, it's less of a hit to that patient. I think that patient understands that like you're trying to make them feel good in both their experience and their result, and that like that will get taken care of. But if you're kind of like dismissive, if they're just kind of going through a chain of rooms and then they're out, and it's like you're at the I think
That
about the
blow's gonna feel
pediatrician's
way
office,
worse,
right? Like I'm like, where do I check
Oh,
out,
yeah.
kind of thing. They are paying for a premium product. This is elective. This is, and I think we need to elevate it to that level to be able to have our patients really understand and enjoy that experience, because that will keep them coming back, right? They're like, I loved being there, right?
Yeah.
One of my business partners, when he started his med spas in Jacksonville. He like created this, like, he had the Toto toilets in there, and people would like come there for the Toto toilets, right? Like, I'm going to stop by there for that day.
Heated toilet seat.
Right,
Yep.
the heated toilet seat. And it's just like small things like that people say, oh, I felt taken care of.
I love
because
that,
part of
right?
that is being taken care of.
I keep trying to tell her to get the massage chairs for
Yeah.
a Zen room. Like, let me just go and sit in that.
Because then we'd find all the staff members in there.
That's true.
Okay, so we like to make patients happy. It's important to us. Is there anything that patients do that stress you out? I can do a list only because I'm a stress ball. It's not that they're
she's already stressed going
I
into
think
it.
the hard thing is when they come in with information that is from a non-vetted source. So there's a lot of Instagram people out there that have nothing to do with aesthetics but are acting as experts. You'll see people reposting quotes all the time from random people. They're not giving proper information that's vetted or scientifically based. It's a lot of opinion, and then people take it as fact. And so I think that's the hard thing to kind of push back on is saying, listen, this person who you thought was a source of knowledge might not be the right information that you're getting. So I think part of my consultation, and I tell every patient this, is it's an education session. So like whatever you read on Reddit or Instagram, you can kind of like get those questions answered. But I can teach you your anatomy, and I can teach you the science behind your anatomy and the pros and cons of the procedures that are options for you. Some are better options and some are less good options. But like you need to decide that for yourself. It's your body. I can give you all the information and it's your body. You need to pick for yourself. I always get patients coming in, what do you think I should do? Well, if you don't have a good set of information of what you want taken care of, your chief complaint, if you don't understand that, and then you don't understand the anatomy that relates to that, you're never going to be able to be happy with that decision. And that's kind of that shared decision making that they talk about in the hospitals, but that's a real way to do shared decision making. And
because you're not telling them the answer, you're helping them, you're leading them to the answer that they already have within themselves.
Because otherwise they've come to you with an answer, right?
And then
that
you're
they
having
found
to break down,
online, and you have to
Something
then break
I
it
say
down.
a
That's
lot
stressful though when they
during,
come with that wall.
it's kind of like chief complaint or the boob example where she wanted natural, but then you realize you don't. Something I always say during my consults are like, I'm trying to get into your psyche right now. Like I feel like I have to get into someone's psyche because there's so many people that think they want something, but then you like hear these tidbits where I'm like, I don't know if they really know what they're talking. Like they want this instead. So like getting into people's psyches are so important to me.
Yeah, right. We're
consults.
just like little therapists.
And I think the industry has pushed us in a way to like avoid that. Like we're in this kind of facial balancing or, this attempt to push a lot of product on patients, and then we completely ignore their chief complaint, right? And so they come in saying, I want facial balancing because I heard someone say it, but what actually bothers you? Because if you start treating someone for things that don't bother them, they're going to leave not feeling great about themselves because they're like, I didn't know my temples were hollow. I never even noticed my temples.
Yeah, and now I just spent a bunch of money on fixing
and now
them,
I spend a bunch of money, and
now
I feel bad because I didn't realize I had bad temples, right? Like, but they actually came in because they wanted their lips done, right?
Yeah.
And
I do
the
think
industry's
it's
kind
such
of
a
pushed
balance
That
us
was the
with
first
that,
thing that
though,
happened to me
like-
with my friend who was in this industry, and she pointed out something I never even noticed, and then I just couldn't stop looking at it.
And people don't feel good, right?
hard.
You want, in the end, we said we want people to feel good when they leave our offices. So
Yeah.
if someone came to you like, what do you want done? And I took apart based on every measurement, like what it should be, like who's going to feel good after that?
Yeah.
Exactly.
Like take care of the thing that they
It's like
there
Mean
for.
Girls with the little
I'm
marker and stuff.
Exactly.
Yeah. Yeah, it is interesting. I'm sure we could have an entire discussion about the consultation process, and we probably should one day because it is the most important aspect
It is
of the
the
entire.
most important thing.
Hands down, yes. Okay, so we're gonna get into a topic here that I think a lot of people might have heard this term also, PE, being thrown around like that they either don't know what it means or they don't understand. They know
What I
that
hated in
private
elementary school.
that PEs and the concept that we're talking about, it stands for private equity, but what does that mean? It comes with a whole lot of, different thoughts behind it. I just want to hear your thought process on it, and you can, delve into as little or as much as you want, but I would love to just hear, like, what's happening with private equity right now in the aesthetic industry, and, like, why are these investors so interested in aesthetics?
This is a really interesting topic, and it's very hot at the conferences too. People are talking about it, both on the med spa side and on the plastic surgery side. And I think at its core, we have to think about it not really in a good or bad way, because I think what we hear about is we always hear about the bad things, right, that happen. And we never hear
From our
about the
standpoint,
success
for sure.
stories, right? And I think there are a lot of success stories out there. And I think alignment is the key in all of this. Because in the end, we're all like startup companies, right? Like every med spa is a little startup company. And eventually that startup company has to grow to a level past its own capabilities, right? Once it maxes out, what's the next step? Once you're maxed out, you either stay stagnant forever or you grow as a mom and pop until you, I don't know, make it a public company and you IPO like SpaceX, right? But what you need is investment along the way usually, and some improved business leadership to really scale something that you've built that you love and that model that you like, and you want that to go and treat more patients, right? You want to be able to reach more patients, but you're only you, right? And you have a max capacity.
Yeah.
So how do you do that? And the answer is to bring in investors, and private equity is an example of an investment. And that's how you get this startup to really grow into a big business, right? Now, with investment comes loss of control, because they're not going to give you money for free to do that.
yeah, they
they
want
give
some
you
skin in
money
the game.
because they want skin in the game. They buy you, you know, the people who invested early in Tesla and other companies like that, they made a risk. It could be zero and their shares are worth nothing, but now their shares are worth stuff. And then at some point, the number of shares, you know, dictates a seat at the board table and decision-making process, because it's their money on the line too. So they want to make sure that that money does something.
And so that's where the alignment comes in, right?
That's where
Because
the
if you
alignment comes
have
in. Yeah.
these investors who have a very similar,
Shared
you know,
opinions
shared,
versus
yeah,
non-shared opinions, and then you're fighting.
or just
about-
like even the vision of how you want the future of your business to look. And if that's very similar, then you guys are probably going to, you know, perform
Right.
like business in a very congruent manner. If you don't, then things can just start to feel inorganic from the way that the business was when it first started, right? When
Yeah.
it was a startup.
And I think this is always a tension in not just in aesthetics, but in every startup.
It's just kind of
Every
happening in
startup.
aesthetics. So
You
everyone's
watch
talking about it, but
the
it's been happening for
Facebook movie, right? It happened there, right? Where one guy got like knocked to the side because the investors came in and said, "We can do your job." Like, this is a very common story. I took a year out from residency and I went and did a fellowship over at Stanford, and I did a investment fellowship with the Life Science Angels, and I basically did the due diligence for them from a science standpoint on which life science companies, startups to invest in as their earliest stage, the riskiest investment. And it is interesting to see the other side of things, because you also don't want to throw money away. Like, this is not like a Make-A-Wish passion project that you're just throwing some
every time you make money, you just dump it back into the
right?
business, right? Yeah.
These investors need to make sure they make a return. That's their job. And I think sometimes the, you know, business owner who was actually the physician or the injector or somebody else in that process who doesn't have that background may not understand some of the nuances of those decisions, and then they seem like they're very impersonal decisions. So that's where that communication and alignment with those groups makes sense. I think where I've seen that be successful is where actually people know other people who've gone through that process, and then they become almost like sister organizations, and they're able to kind of feed off each other. So I think that's I don't think it's a good or a bad, but it could go really well and it can go really ugly, especially if you have business people trying to run clinical operations without clinical input. There's a balance to be reached there. There is you can't just buy every laser in the world that you want. It just doesn't make financial sense.
It's like on a small scale with Leslie and us. He's like the business side, and it's like we're the clinical. And sometimes he has to we may want all this stuff clinically, but he's like,
Correct.
nope.
Yeah.
Yeah, so it's
the,
put on a
the
big
guy in the
scale.
sky is telling you no because it's going to cost too much money.
And so that is the main tension, I think, when we think about startup and investor. You kind of require both to push forward and grow something to what you've dreamed of becoming, more than just a mom and pop shop, and you want to have your vision across many patients. Well, you're going to need some help doing that, because you can't multiply yourself
So
50
PE
times.
is not necessarily a bad thing. It's just that alignment is key. And I think, from a consumer or client perspective, do you think that they can tell if a medical spa is run by private equity or has that component in them?
I think as a consumer, it's really hard to tell which is better for you, because sometimes the mom and pop shop can't keep up with pricing, because when you have the private equity group in there, you get group buying and the pricing for everything goes down. So therefore, if you pass that along to the patient, you can, or you can do discounts for your longtime customers and things like that. So it could really benefit your consumer in keeping prices down and offering maybe even higher level care or higher level products that would otherwise be too expensive to do for that patient or for the practice. At the same time, you can see it where it goes the other way, where, people are being asked to cut corners and clinically, see patients in shorter periods of time. And, that's not great for the patient either. So I think they have to see how their experience is changing as these organizations do come in. But I wouldn't say it's necessarily good or bad.
Exactly.
You just have to
It's
see
very
how that
situational, it sounds like.
affects things. And it's impossible to know 100% if it's going to
Like
work out.
rolling the dice 50-50, I guess.
I mean, it's like
either good or bad.
It's like a marriage, right? Like you
It's
have
just
to
a
know
trial,
that things
right?
are aligned, but sometimes you can't tell if everything's
So is
aligned,
divorce
right?
easy with it?
I think it is tough. I think there are times that it doesn't work out. We've seen it more on the plastic surgery side than on the med spa side, and sometimes the value of those practices go down immediately, and the people who are the owners get left with nothing, right? So that's like a hard reality of it. But it's like, what's the alternative? Do you keep
Exactly.
just
Like
going at the same pace, or do you want to continue to go at a high pace and continue to see your vision spread across?
Sometimes it's inevitable. It just sounds like you have to put a lot of thought and
Yes.
effort into making sure you choose the right investors.
And there's probably things that you can do early on with your kind of business advisors and things like that to make that transition more palatable or easy, rather than having things kind of in this discombobulated place where they come in and say, wow, these guys don't know what they're doing. We have to rework everything. So making it almost like an easy transition.
We will continue moving on, and we'll get in a little bit.
Right, now we're getting into the ethics
Okay,
of
let's
aesthetic
do it.
medicine.
Just like
although
drilling you today.
I
You
feel
feel
like
like
you have very PC answers, because when I asked you for the craziest thing, that was not very crazy. And I know there's crazier patients out there. So don't
There
be
are
so
crazy.
PC.
There are crazy patients out there.
Hopefully not the
okay.
ones watching this.
Is there anything? Yeah. I mean, listen, my husband told his mom I was crazy the first time he told her about me. So crazy can be good, just so we know.
There you
That's
go.
true.
He married
That's true.
crazy.
Yeah, I am crazy. He said he'll never get bored with me. So, are there any procedures like you decline routinely? Like, is there something that like TikTok trends out there and people think it's a real thing, and you're like,
Yeah, I think anything that someone comes in and says, like, I saw this thing on TikTok, and it's usually a branded thing that is not new. I have to say, I'm not going to do this branded procedure. I'm going to do the procedure that is medically in our literature and has been tried and true. Or if it's a new procedure, explain what that procedure is, and that the branding aspect is just marketing.
Yeah.
And I think we see it on the injectable side too a lot, that there's all these branded procedures
think
for
they're
things that
new
everyone can
and,
do.
exciting, but it's just the same old thing that we've always been doing, and
Right.
with a new fancy name behind it.
everyone wants to be like, what's this Nefertiti lift? I'm like, I do it all the time on you.
Yeah, I know.
Right.
Like, it's just talks. They're
It-
like, I
Or
did this. And I
the
was
new
like, I do it. Yeah.
lip injection technique, or like you said, the new like internal bra. It's like these things have been around.
Yeah,
like,
nothing's new
nothing's-
actually. And I had a mentor who once said, either you came up with the newest procedure in the world and you're the smartest surgeon that has ever existed in the history of surgery, or it's already been done. And chances are it's already been done if you look at the probabilities there, right? So, I think we see this both with new technologies too. People they think they come up with this new technology and they say, oh, there's already a patent about it. Well, that means like you're on the right track of something. If like people care about that problem that someone else is working on it, then that makes sense. But I think the branding part where practitioners don't really disclose that this is like not a new thing. They make it seem like it's this absolutely brand new thing that has never happened before. I think branding a procedure is okay, but you have to be realistic about what it is, right? We call our tummy tucks core restore because we focus a lot on our abdominal wall. And I tell all the patients, like, it's not
a
new.
workout class.
Yeah,
Like
right.
putting the
Sounds like
muscle
a workout
together is
class.
not a new
We're not
thing. What we do differently is that we focus a lot on the abdominal wall as a key portion of that procedure that we spend the most time on. But it's not new to put the muscles together in a tummy tuck, right?
Yeah.
So I
But
think
you're transparent, right?
Yeah,
You're
we
not
have to be
trying to say
transparent
like,
about it.
well, we do it differently than the other surgeons do. Like you said, we put an emphasis on it, but we certainly are not reinventing something here.
Right.
Yeah. Which is a smart way to go.
I want to circle back to the beginning where you're very into the future of aesthetics and things coming out, good and bad trends. Where do you see aesthetics going?
So I think the buzzword is regenerative, right? And
I think we had our whole last podcast about biostimulation.
Yeah, right.
regenerative.
What is
but
regenerative
I think
medicine?
people don't understand what that takes, and that regenerative medicine is also not new. We're just like taking it on in aesthetics and think it's this new
Once
thing.
again, yeah, right.
Like in 1993, Robert Langer and Joe Vacanti published a paper, Tissue Engineering in Science, and that was like the real start of like real medical applications of tissue engineering, which is true regenerative medicine. And I think what we think about biostimulators and other treatments that are increasing collagen, okay, great. Like every single company will show their product increases collagen and elastin at X whatever amount, and they'll show you a slide that shows a little more fibers in this one than this one. But like, what does that actually mean for the patient clinical outcomes? Because a lot of those clinical outcomes, you're like squinting at the before and after.
Yeah, I don't
Right,
like
yeah.
that.
And the squint test,
Like they're
I tell my
showing you
patients,
on a cellular level that
Yeah.
there's like a lot more fibroblasts, but it's like, yeah, exactly. How
But what does that
look on
mean?
their face?
And I think we've also like come back from the principles of tissue engineering where you need both cell, you need a signal, and you need a scaffold, right? So you need all three to make this three-dimensional structure again, or to augment a three-dimensional structure. So this is where we've a little bit lost our way in this biostimulator world, where we're saying we're increasing collagen and elastin, but like, what does that mean? Does collagen equal volume? Not necessarily, because
Does it equal tightness?
does it equal tightness? Because that's the opposite of volume.
Yeah.
So like, you can't tell the same story with the same product, or different stories with the same product, where one's tightening, one's volumizing.
Yeah.
It doesn't make any sense. It can't do two things at once. So I think we have to focus on how do we create these three-dimensional structures where we're regenerating products, which we've been trying to do since the 80s and 90s in all sorts of aspects of medicine. I think about it like if you're trying to build a house, right? You need the instructions for the house of how to build it. You need the wood that's there. If you just throw a whole bunch of wood around, the chances that builds a house are pretty low just by random. And that's where I think biostimulation comes in. We're like, okay, collagen and elastin, go do your thing, but it's not with any direction or organized fashion, right? Like your skin and your tissues are these three-dimensionally, very carefully created structures. You have to both, see you have to really go back to developmental biology to see how were these created, right? And they have these like polarized aspects to it, and they have scaffolds and different time points where different growth factors come in. It's a super complex process how
Just
we are
nerding out
created,
right now.
right? But like, think about how do we create like a human? I've thought about
How do we
this.
create the human?
We're going deep. Like,
Right, but that's
we did a whole other
regeneration.
episode
Waiting
on
for
just
my
the
kids
biology.
to ask me that one too.
And that's
I
why
know.
that's why like developmental biology has
don't
been
know.
so important for this, right? Like I think about like my daughter had like all these conditions where things didn't form properly, right? And it's like incredible how one thing leads to another and leads to another, right? Like if the lung doesn't develop, then this doesn't develop, and this doesn't
So
develop.
interconnected.
And that is an example of how things are done in the
Cell
womb are very
differentiation and
important.
signaling.
Exactly. And so do we think we could just randomly regenerate skin by
By
just
like
throwing
you said, flooding the area
flooding
with
the
some sort of
area with something?
biostimulator. Yeah.
Doesn't make a lot of sense to me. And it's actually incredible that we can form like this, which is why I think going back to those basic science studies from developmental
So are you
biology
not
are
a
important.
Radius fan anymore then?
I think Radius is a great product, and but I don't think that it can build volume in the gluteal region, right? Like,
Oh, that's so funny you say that. I have a debate about that one too.
so like this is where I think
instantly
it can't do two things at once,
Yeah,
right?
right. Like,
I think
Long
it's
term, I don't know.
amazing. It's an amazing versatile filler that you can change its G prime and its rheology characteristics. Which, if you're thinking from a business standpoint, if I want like to have stocked one filler that can do lots of things versus a ton of different fillers, I would pick having one filler that can do lots of things. But I think the biostimulation it can do has some tightening effects, and that's why we can use it in the neck, both for tightening of the neck and then augmenting the jawline with undiluted higher G prime radius, and that can create this like differential of tightening and bringing the jaw out. But
it's
how can
actual
it tighten and then
biostimulating
how can it
properties.
do
So is a
Yeah.
robot
the
going
gluteal
to
area
tell
too?
our cells to make things and cause the structure? Where's the future?
Where's
Are
the
we
AI?
robot?
Where does
Are
the
we
AI
going to be
come into
robots
this?
one day and I get my robot face transplant?
Yeah, I think I was talking on a panel about this, and they're like, are surgeons going to be replaced and are injectors
Yeah,
going to
I
be
think
replaced?
that's
And
the
like
biggest
They have a
question.
robot hand, and
actively,
like
there are companies working on this right now.
they have robotic massages now. So.
But I think it would be kind of silly for us to think that that couldn't happen at the rate that these things are improving. Both robotic technology and AI technology are off the charts winning, and the question is, how do we be a part of that, and how do we make that more human? Because
Yeah.
these are some, I always say, like, surgery is not rocket science. It's kind of like we're car mechanics and we're putting this together. And can somebody put a car together on a Ford factory line? Yeah. And can a robot do that? Yeah. The question is, how is that going to be overseen over time, and how does that get trained? How does that learn? I think it's inevitable, but the question is, how do we get the human component? And I think AI does help us be more human, and a lot of the non-human things to be taken care of by this like third party.
That's
right?
a good way to look at it.
Yeah.
Like, instead of like, forcing it away because you're intimidated by AI, like taking over your job or what all these things that it could do.
allows
But
us
it's
to
like
be more
maybe it
human.
allows us,
Allows us to live a little while it does the hard work.
work for us.
I mean,
and
I
show the
use it a
side
lot in my
can't do.
practice.
What a good positive outcome. That's the first good one. Oh, that's the first good one I've
I
heard.
mean, think
about-
think
yeah,
about
yeah,
like
yeah, I like
a normal
I go
day,
straight
all the
to fear
things you have to do
factor.
that you don't want to do, right? For taking care of a patient, right? Like documentation
Yeah, the
and
stuff that
reconstitution and
takes
all
us
these things
away
are
from
like
the
not
patient.
you being
Present,
you
yeah.
and not being present with that patient. And in the end, like we talked, going all the way back to the beginning, we talked about like connection with that patient, understanding what the patient wants. That's probably the next step for AI to like really understand what that patient wants rather than telling it what it wants.
Yeah.
Rather than being
It can get
paternalistic
into
about
its
it.
psyche.
Like, yeah, it's
Yeah.
like in a psyche, and it can go on your ads all the time and tell you what you need because it already knows what you need, like on Instagram.
It
But
will
it's
get
making
there,
it
right?
work for
Yeah.
us right now. Like, we have to figure out how can it work for us
Together.
so that we can,
in a way, work
be-
together with AI.
And the lawyers say, like, in the end, in medicine, like, no one's going to be able to sue a robot, so there will have to be a human involved somehow. So,
because there's always going to have to be some legal component.
And on the joke.
so,
Oh, well,
but that's a real issue, I think.
so you're open to AI. You're leaning into it. Like, you
I'm
find
leaning fully
you love-
into
yeah.
it.
You can tell.
I
That's
love
great.
it.
Yeah.
I think it takes away all the like, even as a business owner, it takes away some of the monotonous stuff that I have to do, like analyzing the data in my office and even working on things like social media and other things like
It frees up your time to do the things that you care about the most
Right.
instead of the things that take you away from those.
Yeah.
exactly.
So
And there's
that's a good
so
way to
many
look at it.
things, right? If we get back to why we went into this, going back to the hospital and doing all these like things that make people upset and writing notes and pagers and all the stuff that like, people do like taking care of patients on the whole. People like connecting with their patients, and
Yeah.
that's why we went to a patient-facing,
Aspect of
human-facing
that, yeah.
aspect of this. Otherwise, we would have done some computer job that we could do remotely. That would be much easier,
Yeah.
right?
Well, it was so fun to have you on today. We're certainly going to have you back because
We'll
we
do
can,
it again. It'll
we
be
could
fun.
talk for a whole nother hour, but it
I know
was
that
it
was actually
great.
the easiest
yeah.
one. So thanks.
Cool.
It was our first like interview
Yeah.
style, so it was awesome. I hope you enjoyed
Awesome.
it. We
No,
enjoyed
that was super
having
fun.
you.
Thanks for having me.
Great. Well, we'll be
Okay.
back.
Let's do it. Awesome.